Hi guys, it gives me an immense pleasure in welcoming you all to my channel Precise Dentistry. I am an intern here to help out the people who are pursuing the first 4 years of dentistry. So as you all know, dentistry is all about precision. That is, you have to be more precise in your clinical skills, in your theoretical knowledge. So that is why I have named my channel as Precise Dentistry, and here I'll be teaching you from small, minute things to the big things which are very important, which you should never forget. This PPT is basically to help out the first year dental students who are into dentistry without having any knowledge about what are the subjects, what are the various fields that is present in dentistry. In this PPT or in this presentation or in this video, I'll be mostly saying about what are the different fields and what are the different books that is to be used for the particular subject. Let us move on. So, as you all know, there are ultimate goal of each dental student is to reach the internship without getting stuck in the middle. So that is the aim for us. So for that, there should be a right planning and a right pathway so that we can reach the internship year very smoothly. So there are certain tricks that you have to know where you can apply it easily to get the difficult ones. So as you see, first year will have four subjects, second year will have four subjects, third year will have three subjects, which is also called as honeymoon period because you only have three subjects and those three are very interesting, and finally will have eight subjects, that is again a headache. So totally there'll be around there'll be around 19 subjects that you'll be learning in the final year. And internship, I personally feel, is one of the very good year where you can prepare all these 19 subjects for your PG. I've just put a very small, points of like essentials of dentistry. So means there should be hard work. You should consistently work. That is again consistent performance. Precision has to be there, and the most important thing is dentistry is all 50% of the practical and 50% theory. So to be more in detail, it will be 70% of the practical and 30% of the theory. So you need good hand and soft skills, good communication skills, and you should be much of like conceptualistic more than that of the theory knowledge. And you should have patience. So patience is very very important when it comes to medical field, either it is medicine or dentistry. You have to be more patient to handle delicate things very easily. So first year is basically anatomy, physiology, biochemistry, oral histology, and tooth morphology. People will feel first year as very difficult. That is because this is a transition that usually happens from school to college. So school will be learning everything superficially, and now we will be going each in depth. Like school days, like we'll be learning biology, that is zoology, as a very superficial one, and when you see here, it'll be very in depth. This is year of basics, and it is the most toughest year because basics are very very tougher than the advanced one. Once you're thorough with the basics, the advanced is like cakewalk for you. So first you have to master anatomy, physiology, biochemistry, oral histology, and tooth morphology. So in this, I'll be detailing about the particular books that you'll be using for these subjects, and I'll also be listing out the standard textbooks. If you're willing, you can go for standard textbooks, and I'll also be giving you alternate that is not equal to standard, but you can manage the, because you only have 1 year to study all these four subjects. I'll be giving you alternative books that can also be used for your exam point of view. So first, anatomy. So for anatomy, there are like two divisions. So the ways of dentistry in anatomy consist of anatomy and histology. So anatomy is basically about the internal organs, muscles, nerves, and the courses of muscles, nerves, and blood vessels. And histology is mainly the epithelial cut section that you'll be staining and studying under that of the microscope. What are the tips to study is that you mainly have to go with diagrams. You have to have a systemic studies and notes. Notes is the particular thing that is going to help you for every subject. So for anatomy, always follow BD Shaurasha. BD Shaurasha can be like standard as well as that of the alternate. It is very good to go with BD Shaurasha from first. And when it comes to histology, that is Neelam Vasudevan book is very good for histology. But when it comes to dentistry, histology is very little part, because we'll be more concentrating on oral histology than general histology. But for the reference, you can use this book. Now, physiology. Physiology is all about studying the normal function of the body, and the book is A.K. Jain. So, A.K. Jain is one of the best book for physiology. You can even use it for your NEET UG preparations too. I've seen people using this for NEET UG for the zoological part of human physiology. So, physiology is A.K. Jain is a very good book that you can go for physiology. And biochemistry is all about the chemical reactions that is occurring in the body, and you can go with Satyanarayana, which is very nice book. We have a very point wise detail that is given in by Satyanarayana. And oral histology and tooth morphology, we don't have any other go. We have to go with Orbans. Orbans is one of the standard books. Once you master Orbans, everything becomes easy, because Orbans is so in detail. It will take a lot of time to study Orbans. And Wheelers is too much, but we can take out very important points from Wheelers. And Wheelers is for dental anatomy. Dental anatomy is basically studying the tooth morphology, whereas histology is studying the connective tissue or the soft tissue as well as the hard tissue of the tooth under the microscope. So second year is basically the year of knowledge, because second year will be completely based on the first year, and second year will be little tough, but you can manage somehow. So general pathology. So general pathology is, you know what, general pathology is nothing but when you know the physiology, the deceased part of physiology is pathology. So pathology, you can go with Robbins. Robbins is a standard books. It comes in 2 volume. You can either use Robbins. It is a very good book, or you can go with textbook of pathology from Harsh Mohan. Harsh Mohan is also a very nice book, but the standard one is Robbins. For pharmacology, you can use either of these, either Kerry Tripathi or you can use Tara Vishenberg. So pharmacology is basically all about drugs. You have to spend more time on pharmacology. You have to divide like 60% of pharmacology, then you divide 35, 30, you divide the rest 20, 20, or you can either go with 40% of pharmacology, 30, 30 you can divide. So just give more time for pharmacology. Then microbiology. So microbiology textbooks is you can use CP Baveja or Anantranayana Panikar. Both books are equally good, but CP Baveja is little easy to study. But if you want to know more in detail, and if your university is expecting more in detail, then you have to go with Panikars. So dental material, again, you will not understand dental material seriously until you come to final year, until you start using the material. So, okay, fine. Dental material is basically about the property, how you manipulate the dental materials that you're going to use for the patients. So, you will not understand this concept until and unless you start using, like you start mixing alginate or you start using plaster of Paris. So, once you touch and feel the instruments, and once you face difficulties while manipulation, that time only you will understand the better properties of the material. So you can use Phillips, or that is also known as Anisavis, but this is very difficult to follow. So most of them will suggest you Mahalakshmi. So for second year level, you can go for Mahalakshmi, but if you are smart enough, you can go for Anisavis. So third year, as I've already said, it is a honeymoon period. Why it is called as honeymoon period is you only have 3 subjects for 1 year, and the 3 subjects are more interesting subjects than any other subject in dentistry. So first you have general medicine. So personally, my favorite subject is general medicine. You can know a lot in general medicine, because your oral medicine that comes in the final year, oral surgery that comes in final year will be most dependent on the medicine and surgery that you study in third year. So for general medicine, the standard books is Davidson. Davidson is very difficult. It is a very big bulk book. So you can use Davidson for certain topics that I'll be specifying in later videos. And for medicine, you can use George Matthew, which is very nice book, and you can also use Alagappa. Alagappa is mainly for the practical point of view, and George Matthew is mainly for theoretical. And for general surgery, again, one of the important and my favorite subject. So general surgery, you can use SRB's Manual of General Surgery. That's the most commonly followed book, or you can use Manipal. So both of these are mainly for theory, and for the practical you have to use DAS. So when it comes to third year and final year, there'll be split of theory and practical that you'll have to separately learn. So it will not be like second year or first year where you have combined of all those. So this is how it is going to be. And for oral pathology, you can use Schaefer. Schaefer is most commonly followed book, and Nibble. So both of these, either of these you can use, or you can use both for, you can study like whichever chapter you're convenient in Schaefer, you can go for Schaefer, or you can go for Neville. And you also have Manual of Oral Histology, that is Magidose, that is mainly for the theoretical, practical knowledge. You can see nice diagrams that is being given in Magidose for the reference of these subjects. And finally, again, it is a year of hard work, because you have 8 subjects on your head, and I'm dividing it into four. So I'll be explaining in order. So I've put this order in the easiest one to the hardest one I've put. So easiest is oral medicine, because oral medicine is same as that of the oral pathology. The difference is that you will be learning the medications to treat in oral medicine, but you will be emphasizing more on histological part in oral pathology. So oral medicine, the standard book is Bucket, and again, oral medicine is of two: oral medicine and radiology. Radiology you have to study separately, and medicine you have to study separately. Your question paper will have part A and B, where A will be medicine, B will be radiology. So radiology, the book is White and Furrows, that is to be followed compulsorily. Oral medicine, you can go for Burkitt's. Burkitt's is a standard book, and the alternative book is, again, we have Anil Gomes. Anil Gomes is also a very nice book, but if you were if you can go with Burkitt's, it is well enough to go with Burkitt's. But some lesions like leukoplakia, squamous cell carcinoma, and all, you can study in Anil Gomes. It is very nice in Anil Gomes. Pediatric dentistry is one of the easiest subject, but you have lot to learn. There are more, you have much of volume. You can either go for Shobha Tandon, but Shobha Tandon, I personally felt that it isn't coming in two volume, and when you have 8 subjects, the other 7 subject also you have to look at. You can't focus on you can't use two different volumes to study. So it is better to go with Nikhil Marwa. So Nikhil Marwa is also a very nice book. You have points, point wise. You know, the details are very precise, and it is given in point wise, so it will be easy to learn in Nikhil Marwa. So coming to orthodontics, orthodontics is one of the easiest subject when you understand the mechanics. So there's only one book that has been followed. It is Balaji. So endodontics and conservative. Endodontics and conservative is that it is divided into two parts. Endodontic is mainly about treating root canal treatment. It's mostly related to root canal, and conservative is conserving the tooth, like restoration, that you will learn in second year about the restoration. So for endodontics, you can use Grossman's, which is a standard, and Nishaga. You can use both the books. And for conservative, it is Studivans, that is the standard books, and you can use Nilima Malik, Nishagak, Nishagak can also be used for endodontics, but you can use Ramya Raghu. Ramya Raghu is really a very nice book and easy book to follow. Next, you have prosthodontics. Prosthodontics is all about dentures. So you can use either Rangarajan, or you can use Deepak Nalaswamy. Periodontology, it is one of the toughest subject. You have to concentrate more on perio. You have to use Karanza. Karanza has, Shantipriya Reddy can also be used, but Karanza is a standard book. So you can use Shantipriya. Shantipriya is also a very nice book when it comes to exam point of view, or you can use both the books equally. Oral and maxillofacial surgery, you can either use Nilima Malik, or you can use Chitra Chakravarti. Both the books are equally good. And public health dentistry, you have to go with Soban Peter or Park. Both are standard books. Both are really very nice books. You can go with any of these. So that's all. The next video will be on, I'll be starting with the subjects like anatomy. So if you really like my video, like my way of saying you things, give me a like, do share my video, and subscribe to my channel. Thank you.